115 people died from coronavirus in just 24 hours in the UK as the government announces a multi-billion-pound rescue package for the self-employed. Millions who work for themselves will now be able to claim 80% of their average monthly profits, up to £2,500 a month.
The scheme I've announced today is fair. It is targeted at those who need it the most, and crucially, it is deliverable, and it provides an unprecedented level of support for self-employed people.
Vast tanks of oxygen installed at a London conference centre being turned into a temporary hospital as the capital's intensive care units deal with wave after wave of sick patients.
In some places they are really struggling. They're just about keeping their head above water, but in 3 or 4 places it's clear that they will run out of critical care capacity probably by the weekend.
The United States now has the highest number of cases in the world. More than 81,000 people have tested positive for coronavirus. Here, the nation applauds NHS health and care workers to give thanks for their tireless work as they try to save lives. And the royals join in too, with Princess Charlotte, Prince Louis and Prince George showing their support.
Also tonight, as the Army is drafted in to help transform the Excel Centre for Medical Beds, we look at the latest plan. And some residents are left frustrated as parks are shut because social distancing.
Good evening. Millions of Britain's self-employed workers whose jobs have disappeared in the fight to control coronavirus have been told that they will be able to apply for a grant of up to £2,500 a month to help them cope. The Chancellor said it would provide unprecedented support for self-employed people. The government has come under intense pressure to provide help after announcing last week that it would cover most of the wages of salaried staff. The money will be paid in a single lump sum, but will not begin to arrive until the start of June at the earliest. So if you're self-employed, you will get a taxable grant worth 80% of your average monthly profits over the last 3 years, worth up to a maximum of £2,500. The scheme will be open for an initial 3 months to people with annual profits of up to £50,000, and only for those who earn the majority of their income from being self-employed. It comes as the death toll rose by 115 in the past 24 hours to 578. It was the single biggest daily rise so far. Here's our political editor, Laura Kingsbank.
Happy days like this are on hold, so Vicky's wedding business and income is gone.
I personally only have enough savings for about a month for my family. It would be heartbreaking for so many of us in the bridal industry to close over something we have no control over.
The States has tonight overtaken China and Italy to become the country that has recorded the highest number of coronavirus cases anywhere in the world. More than 82,000 people have been confirmed positive. Now, Europe is still the epicenter for the global pandemic, and restrictions on people's lives continue to be ramped up across the continent. Spain has extended its coronavirus lockdown another 2.5 weeks until at least April the 12th. The number of cases has reached more than 56,000. More than 4,000 people have now died. In France, the number of confirmed cases has now jumped to almost 30,000. Almost 1,700 people have lost their lives, including a 16-year-old girl. And there's been a big jump in the number who are critically ill there, almost 3,500. In Italy, the death toll has climbed sharply again, with more than 80,000 cases and more than 8,000 deaths, most of them in Lombardy in the north. But there are now fears that southern Italy could be facing a similar outbreak. The Centre for the Global Pandemic, and restrictions on people's lives continue to be ramped up across the continent. Spain has extended its coronavirus lockdown another 2.5 weeks until at least April the 12th. The number of cases has reached more than 56,000. More than 4,000 people have now died. In France, the number of confirmed cases has now jumped to almost 30,000. Almost 1,700 people have lost their lives, including a 16-year-old girl. And there's been a big jump in the number who are critically ill there, almost 3,500. In Italy, the death toll has climbed sharply again, with more than 80,000 cases and more than 8,000 deaths, most of them in Lombardy in the north. But there are now fears that southern Italy could be facing a similar outbreak. Mark Lone has this report.
In today's Italy, the essentials are food and solidarity. This hospital has opened a new coronavirus wing, and it's already under pressure. The peak hasn't yet been reached here. With crematoria bursting, the army is clearing coffins away. It's that word again they're more used to. War. Man versus virus. And the latter is still winning. Mark Lowen, BBC News, Rome.
The South African government is trying to get ahead of the spread of coronavirus. So far the country hasn't recorded any deaths, but nearly 1,000 people are infected. A lockdown has just started there. Our correspondent Andrew Harding has been looking at how the nation is preparing to stay at home for the next 3 weeks.
The beaches of Cape Town are already empty. The lifeguards sent home. And in Johannesburg, the middle classes are queuing for supplies ahead of tonight's lockdown. Polite, but jittery.
It's panic, just in case. Just in case we are asked to stay indoors longer. So yeah, part of it is panic, I think.
Panic and a bit of common sense.
Yes, yeah. And you said she collapsed. Is she conscious or unconscious?
Medical teams here are gearing up for a dramatic increase in coronavirus cases. This is a developed nation which has planned well for the pandemic, but still.
Thank you. Well, coronavirus causes the illness known as COVID-19, and scientists say for most people who get it, the effects are mild. It is a new virus, so how much do we actually know about it now? Why it affects some far more severely than others? And if you do get it, do you become immune? Our science editor David Shukman investigates.
In the race to understand this new virus, we've learned a great deal from a massive international research effort. But some critically important questions still need to be answered. The first of these is a real mystery, but something that's vital to get a handle on. We know that people with symptoms can pass on the virus. But what about people without symptoms? So the question is, who really is spreading the virus right now? This is crucial for working out the future of the outbreak. Many adults may not even realize they're carrying the virus. And children often don't show many symptoms at all, but may have a role in passing it on. The scientists are struggling to work this out.
Most individuals who are infected with novel coronavirus will have very mild symptoms or no symptoms at all. And yet their potential to spread the virus is real. We have to get an understanding of just how much virus these people are transmitting, particularly if we're going to get a lid on this outbreak.
Next, there's something that's far from understood. Can you become immune? In other words, if you catch the virus, can you get it again? It's well known that the virus has the ability to invade different kinds of cells. And early studies have shown that antibodies can respond. But does that create immunity? And how long would that last? No one's sure.
We know from other human coronaviruses that immunity can be fairly short-lived. That's why they reinfect us. But hopefully it will last at least months, if not several years. But these are important things to address.
Then there's a question that's been puzzling many experts. Why does it seem that more men than women have been dying of the virus so far? A major study in China found that for infected men, the death rate was 2.8%, while for women it was 1.7%.